Hello everyone, and welcome to Restorative Health Solutions. If you understand what's making you sick, then you can start to understand how to get better. More information is power. Hello everyone, I'm Dr. Warren. Today I'm going to run through Bartonella and the importance of this co-infection. It is the third most common co-infection, and it really mimics Lyme disease, and it really is different than Lyme. And so when you're fighting this, if this is part of your problem, you really need to make adjustments in order to be successful, in order to heal, in order to have a healthy life again. So I'm going to run through a bunch of questions that my team's put together about Bartonella. I'll try to keep kind of each question, like question answer, pretty succinct. So let's just dive in. All right, so what's the difference between Lyme and Bartonella? They are two different bacteria. One hates oxygen, one loves oxygen. Lyme likes to live in your joints and in your nerves. That's where the Lyme physically is in your body most often. And Bartonella likes to live in epithelial tissue. So think skin, but really its favorite tissue is that epithelial lining of the blood vessel. It is complex in that it can go chronic just like Lyme, but it has a different evasion system. Lyme really likes to form biofilms, and Bartonella is an obligate intracellular bacteria. That just is a fancy way of saying it lives inside your cells, whereas Lyme likes to live in between the cells and form that biofilm protecting it. How often do they occur together? In chronic Lyme, they occur commonly together. So remember, when we just get Lyme, we get better. So if you have 100 people Lyme disease, 80 people just get better. About 20 of them go chronic. Of those 20 that are going chronic, 19 of them have a co-infection with the Lyme. So the vast majority of people who are chronic have a combination, and it is the combination of two or three things together that is enough to where your immune system can't get over it and you end up being chronically sick. Now, how often is that combination Lyme and Bartonella? Well, Lyme's the most common, and Bartonella is number 3. So I would say I bet I see this out of 20 to 25 patients a month. I probably see Lyme and Bartonella comboed 8 to 10. The only combination that's more common is Lyme and Babesia. And then you can obviously have people who have more than two things, but the Lyme and Bartonella combo is probably the second most common combination that I see in my office. So Lyme and Bartonella interact in a way that really double hits your nervous system. So the keys here are Lyme and Bartonella are hitting your nerves and joints in two different ways. Lyme directly goes in the joints and nerves, creates inflammation there, and then Bartonella starts to create problems with the blood supply to that area, therefore amplifying the problem. Now we tell people it's like you're in a boxing match, 2 against 1, and you're being hit from two different sides, and that makes it hard to heal and function. As far as symptoms go, both Lyme and Bartonella create fatigue, neurological symptoms, and chronic pain. Bartonella is famous for more aggressive neurological symptoms, and because the way it works is it gets in your circulatory system or the lining of your circulatory system, because it really likes epithelial cells, which is the skin lining. It can be directly on the skin, but its favorite tissue is the lining of the blood vessels. And as it messes up blood flow, we get hit with a double whammy. So remember, Lyme lives directly in your joints and nerves. Bartonella lives in the blood vessels, and therefore now we don't get blood to our brain, and we don't get blood to our feet, and we don't get blood to our fingers. So particularly Bartonella causes a lot of circulatory issues, which leads to a lot of symptoms in the feet, can lead to symptoms in the hands, and a lot of symptoms in the brain. The other thing with Bartonella that's very common is many people have either had chest or heart workups because Bartonella, with its involvement in the circulatory system, whenever that happens, people often get scared. So we get ER visits, we get heart echoes, we get big heart workups. We often get told everything's totally normal, but it's very common for my Bartonella people to either been to the ER or had a pretty thorough cardiac workup. Some people can get this confused with Babesia because when you have shortness of breath and chest problems, Babesia is famous for the shortness of chest and breathing, but Bartonella can cause that also. But we really think of Bartonella when we have these skin streaks that kind of look like stretch marks. If you have what look like those stretch marks from weight change and you don't have the weight change to explain it, or they run the other way, they don't run the way that would make sense for skin or fat loss to really be stretch marks, then you're really dealing with Bartonella. That is definitive when it's there. but it's not there on a vast majority of cases. It's like the bullseye rash with Lyme. When you have the bullseye rash, it's very definitive, it's Lyme, but you can have all kinds of people with Lyme without the bullseye rash. So that's similar to Lyme in that way. We definitely have anxiety, irritable, neurological issues such as in Lyme. And this is what's so confusing, guys. Remember, Lyme plus Babesia. The Babesia makes the Lyme more aggressive into the nervous system. That is data out of, I believe, Rutgers Cornell. Then we have Bartonella, which can cause aggressive neurological symptoms. And then we have the neuroinvasive viruses like Powassan and tick-borne encephalitis virus that can give you a lot of neurological symptoms. So when I have a neurological Lyme case, remember, my practice is about 80% neurological Lyme. It's 99% Lyme at this point in time, and it's 80% neurological Lyme. The issue is when you start to unpack it, neurological Lyme is a conglomerate of some of it's Lyme, some of it's Bartonella, some of it's the viruses, some of it's Lyme plus Babesia, and some of it is, anaplasma creating chemical toxicity. So it's really a big deal when I get someone in the office to start running thorough testing, because those are very different approaches. You've got bacteria, you've got parasites, you've got viruses, you've got, it's just a completely different ballgame fighting Lyme versus Bartonella versus some of these other bugs. And so when we have a lot of feet problems below the shin, and I have, neurological things, I have skin things, I have heart things, really starts to go up the Bartonella, antenna. Bartonella in children. When we see tick-borne illness in children, it takes two general presentations. So one, it looks like some kind of inflammatory arthritis that you're seeing in a child, so they have pain they really shouldn't have. A lot of kids describe leg pain, and so that's what you're worried about if you have a kid who doesn't want to be active because they're in pain. A lot of times they don't even tell you they're in pain. They just don't want to do normal things. That's a key sign that you could have some of this going on, including Bartonella. I will tell you, in general, Lyme does more knees and Bartonella does more feet, but that's not an absolute for sure. And then the skin signs, if you see the skin signs, it's always a dead giveaway. That's always a nice, clear thing if it's there. And then a lot of these are neurological. So you get behavioral problems, you can get oppositional defiance, you can get problems at school. So you start to get weird behavior problems, or what either turns into kind of panic anxiety attacks in kids or temper tantrums. A lot of times it's temper tantrums in a kid. That is a sign their nervous system's inflamed, and you're trying to figure out why, right? And this can be very hard because we have parents trying to figure out, is this a behavioral issue? Is this a parenting issue? Is this just a growing up issue? Or is there, something wrong? And typically as we get in, we go, no, this is a little beyond the normal ups and downs of just being a child. How many species are there? Right now we're running 4 species of Bartonella: Henselae, Quintana, Vinsoni, and Elizabethae. What we know about Bartonella, just like we know about Lyme, we first discovered one species. Now we've discovered other species. Just like Lyme, we thought these were very regional. This one's here, that one's there, and now we've realized these things really do travel quite well. What's confusing about Bartonella to most people is when you Google it, it doesn't come up under ticks. It really should. I think it's a huge oversight. It is, by most of the data I've seen, the 3rd most common tick-borne infection, but everybody just talks about cats. So Bartonella can be carried by any mammal. There's versions of Bartonella carried by different mammals, but about 15% of cats may be infective, whereas like 3 to 5% of dogs. But it is also something that's known really well in the veterinary world because vets are exposed just because they're around so many animals. Vets are exposed and have a larger risk for Bartonella. So this is also when we go to Lyme conferences, vets are there because animals get Lyme disease and Bartonella is a pretty big deal in the veterinary world, like a really big deal in the veterinary world. Bartonella, as far as testing goes, shares a lot of the same problems we have with Lyme disease. So in Lyme disease, the doctors typically run just one test for Borrelia burgdorferi. We've talked about this, but we're running 18 different species and a much more thorough test. Bartonella has much the same problem. We run one kind, or doctors a lot of times will run none because it doesn't just pop up on the tick stuff. So I do see a lot of tests where people will run the standard test, not very thorough, but standard tests for Lyme, Babesia, Anaplasma, or Ehrlichia, and there's absolutely no Bartonella testing. So it's important to run Bartonella testing when you're running ticks because it is very common. Also, It's important to note that Bartonella is not really well affected by doxy once it's chronic. We've got studies on that. All right, is Bartonella a serious infection? The doctor word that we use that I'm going to replace here with serious is called virulent. Is it virulent? And we would use the word like aggressive. In general, no. It's not aggressive in people who do not have immune deficiency. So when we see, straight up medical Bartonella outbreaks, we see it in things like World War I trench fever, or Peru building railroads, or in immune deficient patients who have like AIDS or HIV, for example. But that doesn't mean it can't wreak havoc and really ruin your life. So I would say it's serious in that if it's affecting your life and inhibiting you from living your life, I think that's serious. One of the problems with Lyme, Bartonella, is they're not highly deadly. And one of the problems we have is if it just disables you and ruins your life, but you're alive, unfortunately, you don't get as much medical funding and research. So I think they're very serious because I think this is ruining people's lives. But the fact that they're not deadly to a large degree means we really have not focused on them in medicine. And it's just newer that we're seeing how much they're impacting the quality of so many Americans' lives. What supports the body with Bartonella? Well, Bartonella is really an immune system problem. So we have to help boost the immune system. Lyme really hurts natural killer cells. Bartonella really focuses in on the nitric oxide system. Th17 is actually depressed in many Bartonella cases. And you can get VEGF up or down in Bartonella, although it's frequently down. The issue with supporting someone who has Bartonella is you need to help the immune system, but it's a different help than Lyme, where you're really focusing on natural killer cells. You also need a lot of neurological blood flow help. So the big adjustment we're making when you have Bartonella is the way to help the person with Bartonella is often to really aid the cardiovascular system. Almost everything that pops up in Bartonella research that's good for Bartonella is also good for your cardiovascular system. And I don't think that's a coincidence that the main place Bartonella likes to live is the lining of your cardiovascular system. So, things like Japanese knotweed and garlic and black walnut all have terrific research that they're good for your cardiovascular system, your circulatory system, and they're also very good in helping someone fight Bartonella. There are other things as well, but you want to add in a lot of things to a program that certainly help the immune system, certainly help the cardiovascular system, and then we can do some things to help kill Bartonella in its more hidden forms. And there's a great study, 2 great studies out of Johns Hopkins showing some of those compounds. From a lifestyle point of view, Bartonella is tricky. Diet does not play a huge role, and this is like sacrilege to say. In general, when you have inflammation, an anti-inflammatory diet is helpful. But guys, this killed my family. So we were like some of these people who thought like you can help everything through just fix your diet. You fix everything. Like that's where I was, 15 years ago, and we ate, just did so many different diet changes and didn't get a response. So when you are trying to eat healthy for these tick-borne things, the biggest thing is you got to rip out processed food and processed sugar. Sugar is the enemy of your immune system functioning. You can make it worse by eating lots of sugar, processed food, and you can add on to the inflammation from your diet. But you're not going to fix this bug with just eating an anti-inflammatory diet or a paleo diet or something like that. Okay, it's not going to happen. Should you exercise? This is hard. So most people with Lyme Bartonella, you need to help clear out the Lyme Bartonella and then slowly work in activity. That's the vast majority of the case. Some Bartonella people, if you can actually get the blood moving, things like sauna, things like exercise, if the blood actually starts pumping, they feel really good. And so most people can't do a lot of exercise, very light to mild activity, until you're starting to get some of these things testing clear. And then you can ramp up the activity and rebuild their stamina and rebuild their strength. But there are some exceptions in the Bartonella where if you just get the circulation going, people come alive. And I think it's because Bartonella inhibits the oxygen system. If you are having a frustrating time figuring out the root cause of your problems, then very thorough Lyme and Bartonella testing, these Lyme and co-infection testing was the answer for my family after a lot of searching. And it can be the cause of pretty serious, neurological fatigue, heart symptoms that we've talked about earlier. And so if you're experiencing some of these symptoms and nobody's ran really thorough tick-borne testing, then that would be the first step is, okay, call our office. We have a free phone call. We have testing available. Because if you can figure out what's driving your problems, then you can develop approaches to go fix them. And the key towards getting better is being as on target as possible with what's dragging your body down. I hope you found this helpful. I'm Dr. Warren.